Okay, good day, ladies and gentlemen. So we're back again in the second lecture of our parasitology series. So I go by the name Reveiw, and I'm going to be facilitating this lecture. So if you intend to access all the full materials and the revision notes on um, Precision Revision Hub, then you can access the number that's written here. Only a $2 subscription fee for a month is needed. So, anyways, without wasting much of your time, let's dive into the lecture. So, the assumption here is that you're coming here to gain a general overview, or you have read and you now want to revise. So, the way in which I will do it, I will not touch each organism independently. We are looking at the intestinal and urogenital protozoa as a whole, trying to look at the connections between the organisms and how we can understand and how we can organize our information, right? So, starting from a bird's eye view, we have got four organisms, right, with regards to intestinal and urogenital protozoa. So we have got Interamoeba histolytica, we have got Giardia, and we've got Cryptosporidium, and then Trichomonas vaginalis, right? So in that regards, we now need to identify that where does each organism affect. So you've got three organisms affecting the intestines and one located in the urogenital tract. So the three organisms are the ones here on the top: Interamoeba histolytica, Giardia, and Cryptosporidium. And then one that affects the urogenital tract is the Trichomonas, right? So if you get a question that is asking you in regards to that, I don't think that you have to be confused. So let's talk about the first three: Interamoeba histolytica, and Giardia, and Cryptosporidium. So all those three organisms, they characterized by diarrhea, right? So let me just zoom in a little bit so that we can kind of see. All right. So they are all characterized by diarrhea. But the thing now, as you can see, the way that they categorize is that Interamoeba histolytica has got a certain type of diarrhea that's different from the other two protozoa. Remember, all of them, they are protozoa, by the way. So Interamoeba histolytica is giving us blood diarrhea, which we call dysentery, right? Which is diarrhea with mucus and blood. So Interamoeba histolytica gives us amoebic dysentery, and Giardia lamblia and Cryptosporidium hominis, they give rise to watery non-blood diarrhea, right? So that's basically the distinction that you can get when it comes to like the clinical findings of this of these organisms. Anyways, so there's four organisms. The nice thing about them is that I already say that they're protozoa, and then we know that from our study of the protozoa, that protozoa we've got four categories of protozoa, which we call, we've got sarcodina, that is your amoeba. We have got our mastigophora, which is your flagellates. You've got your sporozoa, and then you've got your ciliates, right? So of these four organisms, they are only in three categories. That's your sarcodina, that's your amoeba, your mastigophora, and your sporozoa. We do not have ciliates here. So if you have a question that's asking you on those four organisms and you put a true on whether one of these organisms is a ciliate, then you know that you're wrong. So they are possessing three, they are in three of this category. So Interamoeba histolytica, from its name, it's an amoeba, it's a sarcodina. Then Giardia and Trichomonas vaginalis, you will see that they are trophozoites, because remember we already spoke to trophozoites in the first lecture. They are trophozoites that have got flagella. So both of them are flagellates, or they are mastigophora because they've got flagella. And then Cryptosporidium lamblia, right? It's a sporozoa, because you see that in its life cycle it goes through the stages of sporozoids, right? And skins and merozoids, things like that. You see that kind of life cycle that goes through sporozoids, skins, merozoids. It's usually a life cycle that's dedicated to the sporozoa. You will see it even when it comes to your plasmodium. You will see it even when it comes to your toxoplasma, right? Anyways, so we have already that's the second thing that we have already classified. We spoke about the diarrhea. Now we spoke about the classifications in which they are in, right? Now, still on the aspect of let me just finish the clinical aspect, um, and then we move on. So, still on the clinical aspect, right? We already highlighted that these three organisms, uh, you find diarrhea. Trichomonas vaginalis, you're not finding diarrhea because the urogenital um, organism. So basically, you are finding things to do with the genital tract. In males, you will find urethritis if they are symptomatic, but most of them they are symptomatic. And in females, you will find a greenish, foul-smelling discharge, vaginal discharge, right? So, still on the clinical aspects, you see that Interamoeba it's the one that also has got a lot of clinical aspects in addition to diarrhea, unlike Giardia and Cryptosporidium, which are mostly denoted by diarrhea. But you see that for your Interamoeba histolytica, you can also have got secondary symptoms in other sites. So, for example, and this is because the Interamoeba histolytica, just a second. This is because the Interamoeba histolytica, it can escape the gut and it can then enter into the portal system, hence seeding itself in other organs. And the primary organ that is usually seeded, because the portal vein, we know that it leads to the liver, is actually a liver abscess that will happen, right? And after the liver abscess, you can also have other seeding in other organs, such as the lungs and the brain, right? And you can also have cutaneous amoebiasis. So that's also one thing that I forgot to actually allude to that. Intermoeba histolytica causes amoebiasis, and then Giardia lamblia, giardiasis, cryptosporidiasis, and same thing. So the AISIS at the end is just denoting that this is a parasitic infection, right? So you can have that enteric amoebiasis, your hepatic amoebiasis. You can have cutaneous amoebiasis even. You can also have cutaneous amoebiasis, right? So that's for Interamoeba histolytica, and I already said Giardia and Cryptosporidium, mostly diarrhea. But the diarrhea between Giardia and Cryptosporidium, they're different in the sense that Giardia diarrhea is foul smelling, and Cryptosporidium usually this one is usually characterized by the aspect that number one is affecting immunocompromised people, especially people with HIV, people with AIDS, sorry, and a lot of electrolytes are being lost, right? So that's that. And then having explained that, now let's cross over to the morphology of these organisms. So all of these organisms have got one baseline, which is your trophozoite. They all pass through the trophozoite stage. There's all those four organisms, right? So if you're gonna have a true or false question asking you about trophozoite in Entamoeba, Histolytica, and the other three, then it's true. And they also have got cyst stages, except your Trichomonas vaginalis. Trichomonas vaginalis does not have a cyst stage. It's only spread through as a trophozoite and through sexual means, right? And Cryptosporidium, it's not actually a cyst only, it's like oocyst. So your Interamoeba histolytica and Giardia, they are cysts, right? But your Cryptosporidium is an oocyst, and Trichomonas vaginalis has no cyst at all, right? And then having alluded to that, for Interamoeba histolytica, so I'm now talking about the life cycles of these organisms. So Usually, you begin by, so before we talk about the life cycles, let's talk about transmission. So the primary transmission of the first three organisms, that's your Interamoeba, Histolytica, Giardia, and Cryptosporidia, Giardia lambda and Cryptosporidia hominis, right, is fecal oral route. And that's why you see that if you're reading your lungs, it's mainly saying that a lot of people affected are homosexuals, because yeah, they have a lot of fecal oral transmission happening there. And you can have the fecal stuff contaminating your food and water, right? So if you're ingesting food contaminated with these organisms, then you are definitely gonna uh, have, right, your clinical presentations of these things, right? Um, and okay, so these are basically the transmission routes, right? And from the first lecture, I already highlighted that the cyst stage is the transmission stage, right? So basically, in these three organisms, you'd have ingested the cyst, which is the infective phase, or which is the infective morphology, which will then convert into your trophozoite, which is the active, the reproductive, and virulent stage of your um, parasites, right? So, having alluded to that, let's then just speak about the prevention. That means that if you're trying to prevent this, just a second, if you're trying to prevent the spread of these infections, then obviously you need to go back to how these organisms are transmitted, right? So basically, we are saying that you can, the cyst stage, you know that when it comes to water, people are used to chlorinating their water bodies, but these cysts, they are resistant to chlorination. So chlorination does not curb the spread or does not kill the cysts. So we're talking that you need to boil your water or filter it, right? That's what can actually remove the cysts, right? So after having said that, now let's talk about the life cycles of these things. So first of all, yeah, okay, cool. It's imperative that we know that the cyst of your Entamoeba histolytica has got four nuclei, same as has the cyst of Giardia, right? And yeah, so it's four nuclei. But then the cyst of Entamoeba histolytica, it gives rise to eight trophozoites, as opposed to two trophozoites that are that produced by the cyst of Giardia, right? Anyways, having said that, so we shall start with the life cycle of Entamoeba histolytica. So you ingest the cyst, and then you go through an encystation phase. So first, the cyst has got four nuclei. The nuclei divide. You have got eight nuclei, a trophozoite with eight nuclei, and then that trophozoite during encystation it will divide into eight trophozoites. These eight trophozoites, the pathogenic property of Interamoeba histolytica is that it invades. So basically, it affects the colon, the cecum, and the colon. So it invades the mucosa, like it's actually invasive. That's where the dysentery part of it comes from. Because if you remember from your bacteriology lectures, that E. coli and Shigella that are invasive, they lead to dysentery, right? So that's what's happening here with your Interamoeba histolytica. Unlike these two, the other two, Giardia and Cryptosporidia, these they just irritate the gut. They either attach, they actually do not, they're not invasive, right? So your some of the trophozoites will invade the mucosa, as you can see here. They will invade the mucosa even up to the muscularis layer, causing leading to flask-shaped ulcers. And then some of the trophozoites will go through what we call an encystation phase, where they will then form cysts, and then the cysts are then excreted in stools, right? So this then leads to the aspect that if you're now doing your laboratory diagnosis for a symptomatic patient, under a microscope, you will see the stool, the trophozoites together with the cysts. But if you are doing the stool sample to a carrier stage person, you will not see the trophozoite stage, because the trophozoite stage is like the infect the stage that's giving rise to the symptoms. So if a person is a carrier, they don't have symptoms, so they do not have active trophozoites. So basically, you will find cysts in their stools. Together, this is the same thing with the other two organisms, whereby in the carrier states, you're gonna see cysts in the stools, right? But in the symptomatic phases, you will see cysts and trophozoites together. And then now, after inverting, so that's the life cycle of your intermediate histolytica, and then the life cycle of your giardia, you've got your ingested cyst, you've got encystation, or existation. I mean, not encystation, existation. Sorry, existation. That's the out of it. You've got existation. You produce your two binucleate trophozoites. They've got discs that they have ventral discs, which then attach to the mucosa, and then they irritate, reduce absorptive surface, and then you've got field malabsorption and stuff like that. And then as for the complicated phase of your cryptosporidium, it's not it's not that well categorized or put in a way that makes it easier to understand, but just know that after ingesting the oocyst will give rise to your trophozoites. These trophozoites will give rise to tissue schizones and in, in the beginning I was saying skins, but you can say schizones, whatever the pronunciation. Pardon me, I'm not a native English person. Anyways, your tissue zones and your merozoites, right? So basically, in fact, sorry, the trophozoites, they will give rise to sporozoites, and then from the sporozoites you've got your schizones and merozoites, right? And then the merozoites, the type two ones, they can give rise to your gametes, which will infuse, and then these gametes they will form a new oocyst, which is then excreted, and then again the life cycle happens again, right? So after having said that, we now after because the life cycle is kind of like intertwined with the pathogenesis, we're then just going to touch on the pathogenesis of the protozoa. So basically, our intermediate histolytica, we said it attaches its enzymes which will degrade the epithelial lining and invade the mucosa. And after invading, they can enter, it causes blood diarrhea. And then, secondarily, they can enter into the portal circulation, seed into the liver, cause liver abscesses, also seed into your lungs and the brain, right? And they will give rise to a lot of clinical or features and stuff like that, right? And then for your Giardia lamblia, I already said that the trophocytes of Giardia lamblia have got a ventral disc, which will attach to the microvilli, and then they will lead to irritation of that uh, and reduce the like the number of microvilli, thus reducing the absorptive surface of your enteric tract, which will lead to malabsorption, especially of the fat, because Giardia lamblia, it affects, we said that the interamoeba affects your colon, but Giardia lamblia, it actually affects the duodenum and the jejunum together with the cryptosporidium. So your Giardia lamblia will then lead to reduced fat absorption, leading to steatoria, right? As for cryptosporidium, you're going to be seeing a lot of cryptosporidium. Basically, its pathogenesis is kind of the same, right? What it does, it enters in the crypts of Lebekan, and then like uh, produces, right, and then it damages the brush borders, and then leads to malabsorption, as well as leading to secretion of substances, which leads to large water and electrolyte loss, right? And then so that's the pathogenesis of these organisms. And then now talking about we already spoke to the aspect of the clinical features already when I spoke that what do we see in Entamoeba histolytica, what do amoebic dysentery. And in chronic carriers of Entamoeba histolytica, you will see that they have got mass in the cecum or rectosigmoid junction, right, which actually mimic carcinoma and need to like be viewed to like make sure that you make the correct diagnosis. So that granulomatous mass in the cecum and the rectosigmoid junction is called an amoeboma. And then we already spoke to aspects of the liver abscesses as well as cutaneous amoebiasis, pulmonary amoebiasis, cerebral amoebiasis, the complications that happen there. And then for giardia, we already spoke to watery blood diarrhea, there's full smelling, there's flatulence, there's cramps involved, there's weight loss, and there is no fever in giardia, right, in my last weeks. And then cryptosporidium, we already alluded to the aspect that it affects people with HIV, with AIDS, not HIV, with AIDS, because they've got impaired T cell immunity. And people with immunocompetence, they usually have a self-limited disease, but this one in people with AIDS, it's persistent, severe, leading to dehydration and wasting, right? And then after having spoken to that, the laboratory diagnosis of your Interamoeba histolytica. Now, because these are protozoa, your O and P, that's your ova and parasite test, they're negative. We already spoke to that on the last lecture. So laboratory diagnosis, fresh stool, microscopical, you're seeing your trophozoites and your cysts, the trophozoites of your interamoeba, they actually have got ingested red blood cells within them, right? But you're not going to expect that from Giardia and Cryptosporidium because we already spoken to the aspect that these are localized mainly in the GI tract, right? And then you can also do serologic tests because remember, anything that gets into the blood can elicit some form of humoral immunity. So here we are expecting that there is some form of humoral immunity, right? So you expect just 2 minutes. Okay. You expect to see some antibodies there, so you can use them as a serological way to try and detect the presence of interamoeba. And then as for the other two organisms, you look at the microscopy, cyst and trophozoites, as well as you can do antigen tests whereby you do, especially for Giardia lamblia, you can do antigen tests whereby you take those antigens and do your indirect ELISA and detect that someone has got this particular disease. And then after that, as for the treatment, so you can give someone suffering from Interamoeba histolytica metronidazole. Someone suffering from Giardia lambda, you can also give them metronidazole. And someone suffering from Trichomonas vaginalis, metronidazole. But Cryptosporidium, there isn't exactly an exact treatment for that. But if you're trying to reduce the diarrhea a bit, you can give them uh, paromomycin, right, which can actually reduce the diarrhea. And then as for asymptomatic carriers in your Interamoeba histolytica, you can also give them the same paromomycin and indoquinol. And then that's it for the first three. And then to just then rush an overview on Trichomonas vaginalis because a lot of things I've already alluded to them. So Trichomonas vaginalis, we said that there is no cyst stage and it's spread through sexual means. Oh, by the way, I forgot to speak about the epidemiology of the first three ones. So Interamoeba histolytica, you find it in the tropics mostly, Giardia lamblia. Oh, and by the way, Interamoeba histolytica, Giardia lamblia, they're mostly they have one definitive host, that's the human. Cryptosporidium, you might find it here and there in your in some cattle and stuff, but the definitive host is actually the humans because remember I said definitive host, that's where you have got sexual reproduction, right? So Trichomonas vaginalis, same thing, one definitive host, humans, and I was speaking to the epidemiology of those. So we say tropics, that's the Interamoeba histolytica, and usually Cryptosporidia, the Giardia, they are worldwide really. And Trichomonas, usually it's a sexual one, transmitted sexually. Usually the most people that are affected, they are women in their reproductive phases, usually below 30, if I'm not mistaken. But those that are postmenopausal, they really do not really get symptomatic with the Trichomonas vaginalis, and usually it's favored in women. High pH favors the propagation of this Trichomonas vaginalis. So basically, if you're trying to curb the spread of Trichomonas vaginalis in women, you're trying to give them medication that literally lowers the pH down there, right? And so you've got Trichomonas vaginalis. We already said transmission is through sexual contact in men, usually clinical features. So in the aspect of clinical features in men, clinical features are not as evident really. Most men are symptomatic, but you can have urethritis. And in men, the Trichomonas vaginalis actually resides within the prostate, right? And so the pathogenesis, you've got your trophocytes, the child touches, then it causes inflammation to the mucosa, which then leads to the discharge and irritation. And to know, you have to note that it does not cause any invasion, right? Um, like does not have the invasive intestinal cycle of intermeba, right? And disturbed vaginal environment may raise pH and stuff. We already alluded to that. Then microscopy. Oh, and by the way, I forgot to say that the difference between the flagellated morphology of your Trichomonas vaginalis trophozoites and the ones for Giardia is that your Giardia has got 4 flagella that are at the sides of your trophozoite, but your Trichomonas, the flagella are located at one pore, kinda, so they're literally 4 anterior flagella, right? And then alluded to the aspect of clinical features whereby women also have got itching and burning and the discharge that's there. And then for the treatment, you're giving them metronidazole. Like I said, intermeba, giardia, and Trichomonas, you give metronidazole. And so basically, this is it with regards to the 4 organisms of your urogenital and intestinal tract. So I hope this video helps you to kind of like categorize your information and make it easier for you to see the distinctions or the to understand between the 4 organisms. So thank you. See you in the next lecture.